common techniques used in respiratory conditions are a combination of posture positioning, percussion, vibration, postural drainage, suctioning, and breathing exercise. But some physios routinely treat most patients with or above, regardless of the patient's underlying pathophysiological condition. And if you can remember from the first module that I said, we must do a problem-orientated approach to our patients, not a signs and symptoms. Because if you've got a signs and symptoms or even diagnosis, but you just treat patients according to diagnoses, then you're going to be in this mode of just doing routine treatment for all your patients. So go according to what's the problem, what is the aim of my treatment, and how can this treatment modality, which treatment modality is best to achieve the aim that will resolve the problem. So that's how we should think, and that is clinical reasoning skills that we should apply to. So the overall cost of medical management of these conditions are very high, and therefore the requirements of all of us working with those patients, we must provide evidence-based practice. It's mandatory. If I ever do my PhD, I will do it in cost management and the cost of physiotherapy, especially in hospitals, and the overuse of it. Because I think a lot of our patients don't need routine physio. They don't need treatments twice a day just because the doctor says so. If I see and I hear through medical aids all the statistics of how many physios do routine BD treatments for all their patients, honestly, I cannot say that all our patients routinely need BD treatments. Even our ICU patients, a lot of times we don't do BD. Because if you get to a patient and the nurse just told you, and say for instance you've done a very good thorough treatment in the morning, you did your postural drainage, and you did passive movements, say it's a ventilated patient, after that you've done everything there, you've suctioned them, you've done a lot of percussions, and you didn't get a lot of secretions out. Now you come for with BD treatment or just BD checkup, and the nurse just tells you, I've just suctioned the patient and there was no secretions. Why do you need the treatment again? So let's think a bit cost effective. And it's our duty to use the resources of our patients, of our country, and our health resources wisely and to the best that we can. And that was my preach for the Sunday morning. There's consensus that physiotherapy management of a critical ill patient should be based on a case-by-case basis prior to institution of unnecessary and potential disruptive therapies.